I had a really interesting situation occur yesterday when I was on our land up in the Kaipara coast. I was with two other people my age, late 60s, early 70s, and one was a doctor and the other one was a scientist. Scientist in his 70s, he's worked hard all his life, and we're discussing health and well-being programs, and with obviously aging there's a bit of wear and tear involved. But for the 70-year-old, the thought of spending $1,000 on his health seemed like an almost insurmountable psychological hurdle, being on a pension and with fixed income. And it was really interesting to me to thought, okay, where does self-value lie? I mean, what are we worth? What's our health worth? What's our vitality, our resilience, and our longevity worth? And the point being that for so many people, $1,000 is such a massive investment in their self seemed perplexing to me, and it really got me thinking even further, because for me at different times my health has cost millions of dollars. We've lost properties, we've lost businesses as a result of health challenges. So for me $1,000 would seem very inexpensive. And there's a psychology involved in this. I mean, again, if we're going to own a house that's worth $1 million, it relies on us being well enough to pay the bills. In my case, there was a time I wasn't well enough to pay the bills on a house, and I had to sell the house and then sell an investment house. And it put our whole family at risk. I was a single parent with 5 children. I had burnout, and many people in a situation like that would have burnout, and I didn't quite know how to resolve it. I ended up having to take 18 months off work and have to rebuild. Even the thought of going to work was an overload. So I know the feeling, what it's like to be that vulnerable. As a result of that, I really strongly encourage people to be proactive. If we don't put enough of an investment in up front and get the right analysis for what would be an ideal program for our well-being, life becomes a bit of a guesswork, and it's not working for too many people. Too many people have burnout, too many people have ADHD, too many people have anxiety, too many people have depression. All of these are systems that can be treated reasonably simply once we find the underlying causes. And there'll be a combination of psychological, emotional, lifestyle, nutritional, often a lack of or too much exercise, and issues around sleep and rest. So with a whole systems approach, all of these issues can be resolved with a reasonable amount of efficacy. In our case, we're looking at a 90% success rate, and it's a whole systems approach we use. My strong advice is not to leave it to the time of life where you think, boy, this is insurmountable or it's difficult and I'm on the back foot the whole time. The ideal time is to get in early. The younger the better. And to look at maintaining a program and get yourself checked up on a regular basis with your epigenetics, which is looking at the cause behind how your genes are functioning. And the genes are just a very clever reproductive system that our body runs. So like with any reproductive system, if you actually put the right nutrients in and have the right lifestyle, your reproductive system's far more likely to be running effectively, whether it's your genes or your biological reproductive system. So the moral of the story of this is a stitch in time saves 9. And these were the types of quotations as a young person stuck in my mind. I mean, if you get in early, you save things deteriorating to such a level where you're relying too much on expensive medical systems that are funded by the taxpayer. I've got a client who the medical system has spent over $1 million with this person already this year, and he's in hospital now. In other words, $1 million hasn't worked for him. I can't go into too many details about this, but when I did a quantum healing session with him, the results before and after were absolutely outstanding. It was remarkable, the difference from 2 hours in terms of his live blood to 2 hours later. So the point I'm making is that there's so many different ways of being well, but the ideal way is actually to get on the front foot, put good quality maintenance programs in place around things like your nutrition, and that usually involves taking some dietary supplementation, around your lifestyle, around sleep patterns, which for many people are a real big problem today, around vocation, around relationships, around the general attitude you have to life and your ability to appreciate life and around your family networks and your ability to show and receive compassion and self-compassion. I think, again, part of the moral of this story was if we don't have enough self-compassion, which for many people is probably their biggest hurdle, it's really hard to expect life to look after us if we're not good at looking after ourselves from a perspective of good quality self-esteem and building good quality resilience into our life. So I'm looking forward to be able to help a lot of you. I mean, we've got systems in place with all our professionals, from the mind-body side of life to the emotional side of life and managing things like resilience and building good quality values, through to the nutritional side, to the detoxing side, and just basically putting lifestyle plans in place and being able to maintain them. So bear in mind, a stitch in time does save 9. It's much, much easier to maintain your health than it is to recover from difficult diseases. Many of these diseases, people are being told this is a lifetime disease and you'll never be able to recover from this. You're stuck on expensive treatments for the rest of your life and relying on medical professionals. Well, in many cases, there are alternatives, and I'd like to encourage you to explore some of these. We've invested a lot of time and money in technology. That's analytic technology and treatment technology, everything from ozone steam saunas through to hyperbaric oxygen chambers, through to very high quality light technology systems or microcurrent systems, PMF systems, that's pulse electromagnetic frequency systems that were developed for NASA to help astronauts stay healthy in space, through to high quality nutritional supplements from vitamins and minerals and essential fatty acids, amino acids, etc. So this clinic has treated over 10,000 people. We've got a very high success rate, over 90% recovery from almost all conditions except the most severe. We treat everything from the most difficult conditions through to just basic well-being. My specialty has tended to be burnout and fatigue because I experienced that myself in my mid to late 40s. It wasn't an experience I'd like to repeat. I found it extremely difficult at the time. It took me 18 months to recover. I'm very lucky that I'm now partnered up with some top people around the world like Dr. Wilson and Dr. Darryl Turner and a few others who primarily work in America but have shared their resources with us and shared their knowledge. We usually can help people feel a lot better within one to 2 weeks and put them on a recovery plan. We can't say how long the recovery plan would take, but basically it's all about maintenance. It's about, like with fitness, getting to a certain level and then maintaining it and not having too many dips along the way. The bigger the dip, the harder it is to recover. So maintenance being the key to this. Really look forward to helping as much as we possibly can. I do 5-minute free consultations just to help get you started if that would be helpful for you. Our website will show all the information that you might need to find out what we're doing, and look forward to being able to help.